All right. Good morning, everyone. Thank you so much for attending this morning Emory Healthcare's speaker series on different health and wellness topics. Today, we are excited to present to you on the topic of caregiving. We are really excited this morning to have with us one of our Emory University partners. So we have Dr. Glenna Brewster. She is an assistant professor at the Nell Hodgson Woodruff School of Nursing at Emory University. She's also a family nurse practitioner at Emory's Integrated Memory Care Clinic. Dr. Brewster attended the University of South Florida for her bachelor's and master's of science in nursing. She also got another master's degree there in gerontology, as well as her PhD in nursing science. Her research focuses on sleep disturbances in individuals who experience cognitive impairment and those individuals' caregivers. And her research has been published in many multidisciplinary journals, including the Journal of Aging and Health, as well as geriatric nursing. So we are very excited and very honored to have her with us this morning. So I am going to pass the baton off to her to get us started.
So I was sharing and then something happened. All right, is everybody hearing me and seeing that?
Yep, we can hear you and see you.
Okay, great. So thank you so much, Lindsay, for the introduction. And I just want to talk today about caring for ourselves while caring for others. Okay. So, and I'm sure we've been hearing a lot about her as her husband just went into hospice, Jimmy Carter, former President Jimmy Carter. So his wife says that there are only four types of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So basically, caregiving is universal. And for me, I talk about when my research overlapped with my personal experience because my grandmother a few years ago actually had a stroke and was diagnosed with vascular dementia. So I had the experience of being her secondary caregiver. I'm supporting my mom, who was her primary caregiver, as we took care of her. So a caregiver is the person who looks after the needs or concerns of others, and we often hear they might be care partner, caretaker, or carer based on the environment in which you are or the culture in which you are, what you're referred to as. So it could be short-term or long-term limitations that this person has due to whether it's illness, injury, or disability. And you're taking care of this person who's under your charge, or the person with whom you interact from the community. And it could be that you're taking care of them in your home, in their home, or maybe even if they're in a long-term residential community, which means the person doesn't have to be an older adult, but it could be a young person, whether it's at home or in a residential living community. And caregiving is not only negative, it is accompanied by many highs, but it also has lows. So some of the highs might be, there might be improvement in health. We've seen that some research that says that caregivers actually perform better when we look at physical or psychological health, and their outcomes. But even for the person with whom they're taking care of, that, this person can also have better health outcomes, improved competence. So they might feel, as the time goes by, that they're doing so much better as a caregiver. They oftentimes, with time, find a community and find and develop resources that work. They may feel better or perform better at work also. But with lows, it can be the opposite of that based on how much your caregiving responsibility is, that you may experience declines in health or changes in your health, because whether that's physical or cognitive, because you may not be finding the time to take care of yourself. So your annual physical, you might cancel that because you have to take your loved one to do their physical and to take care of their health. So you might be a caregiver to the neglect of your health and your health outcomes. And research have shown, and this is in caregivers of persons living with dementia, that spousal caregivers with 6 times more risk for developing cognitive impairment and cognitive declines themselves compared to those who are not caregivers. So it could be on both ends where you have improvement or declines in your health. The lows might be moving the person into a personal care home, and it could be that they are moving them into a home because maybe you have to travel, or you have to move from where you are, or it could be that they have become progressively more dependent and now you have to provide more hands-on care, that if you're working you may not have the time or ability to do that. Or thinking about dementia again, it could be that they have become, they have changed in their personality. So it might be their reacting and responding in angry ways or violent ways that you may not be able to manage at home anymore. Or you may have to give up time with work, and you're not able to get the time off necessary to provide the care for this person. And as an FYI, I have a cold or a sore throat or something going on, so just in case you're seeing any changes in or not understanding me well, that can be why. But hopefully you are. So I have a question for the people who are logged on. Do you see yourself as a caregiver? Are you a caregiver? And what are some of the highs and lows of what you do?
So folks, you're all are welcome to use the chat function as well as unmute yourselves if you prefer.
Or maybe just in general, what brought you here today? Okay, somebody said yes, and it is a lot of responsibility. Somebody was a caregiver for their parents and their aunts and uncles, and just to know that you can be the only caregiver, or you can be a caregiver amongst a group of people who are caring for and responsible for the health care of somebody. So a lot of times we encourage persons, especially as they begin care, to develop a community or a village that you can then come together and determine who would share responsibility for what, because it's great to have support as you're or taking care of that the person. Yes. So somebody was a caregiver for their grandmother and husband, and somebody watched and I'm sure supported their mom as they were caregiver for their grandparents. So thank you so much for sharing. So many times what happens with when you are a caregiver is that the person who is receiving the care might have certain types of behavioral things that you see. And when you see that, is there anything that you can do? So the first thing that we think about might be unmet needs. So are they bored? Many times, and a lot of it that I talk about is my experience being a caregiver for my grandmother, but working with caregivers, is that as of persons living with dementia, is that as the disease progressed, that the person who is living with cognitive impairment and dementia may not be contributing anymore at home, or may not be doing a lot of things around the home or for the family. And as a result, they might be bored, or they might be lonely, or they might be deprived from sensory things. So there's nothing really happening for them. And as a result, then there might be behaviors that you might observe. So it could be that they're acting out and they might become irritable or loud or angry, but it could be on the other end where they might, there might be apathy or depression because they no longer feel that they are able to contribute. And when you see that, how do you assess that? You can think about antecedents, behaviors, and consequences. So, what led to the behavior that you're seeing? So, it requires a definite assessment and evaluation of this behavior that I'm seeing. Is it, that as the evening approaches and we think about sundowning, that I see outbursts, that I see irritability, that I see that there are this changes in who this person was, and we know a lot about sundowning, and is there anything that I can do to kind of minimize that? It might happen, but can I minimize what I might see in terms of the behaviors? So do I expose them to more light during the day when they're awake? Do I, they might watch the television sometime. Can I take them outside to sit behind or to sit on the patio or to interact with somebody? Can I call a relative for them to interact with? And after behaviors, there are often consequences. So when the person may have a behavior, and if you respond to them, are they okay with that response? And then is that response saying that I need to have more of that behavior? So when you think about the child, and if they're in a classroom and they're acting out, maybe because they think the teacher isn't giving them enough attention, and then when they start acting out, the teacher pays attention to them, is that reinforcing then the acting out behavior, as opposed to if the teacher didn't pay attention to the acting out behavior? So what are the things that triggered the behavior, what the behavior is, and what are the consequences? And is there anywhere in the consequences and the antecedents that you can then do something to potentially manage or reduce that behavior that you see? And it could happen in a positive way too. So it could be that, you might want the person who you're caring for to maybe assist with potentially doing a chore. So the behavior might be folding the clothes, and it the antecedent then might be, you are, after you finish the laundry, then you put it in the chair, and then you do a reminder for them to start folding the clothes. And there would be positive consequences like a reward or an engagement of something because of that positive behavior that was seen. So I don't want us to only think about it in terms of negative behaviors and negative consequences. Another thing might be that uh, it could be environmental vulnerability or reduced stress. So greater vulnerability to changes in the environment and lower threshold where environmental stimuli can trigger a behavior. So it could be initially, you're watching television and you see violence on television or loud noises, and before that would never affect the person or cause any type of irritability or loud outburst or angriness or anything like that. But then maybe once more thinking about dementia, as the disease progresses, there might be then a change or a lowered threshold within which the person might respond to then an environmental stimuli. So something on a movie, 2 years after might trigger a behavior, as opposed to 2 years before, it didn't do anything to influence or affect them. And then what are some things that you can do? So many things that you can try out. Sounds. So many people tend to like music, and you find out and identify the type of music that they like. So if they're an older adult, maybe they went to church, they might enjoy music like gospel music, or R&B. So you find out and try different types of music and see which one they enjoy. Even when they're, wanting to go to bed or during the day, white noise. You can try massage. You can massage their hands. You can massage their backs. Pets, if some people had pets when they were younger, or even if they have pets now, some people really enjoy having pets and playing with and interacting with pets. Or if you're able to one-on-one interaction, so going to the person, engaging them, talking to them, providing rewards for desirable behavior, changing your routine. A lot of times, many people, I think about church, or they used to go out and have meals at restaurants, or they used to play games with friends, and after a diagnosis of cognitive impairment or dementia, then they may stop doing that. So potentially, if they've stopped doing that, changing the routine and starting it back. It doesn't have to be every Sunday necessarily, or every Saturday whenever you go to church. It could be, once a month, to see how that person responds to the environment. You don't have to stay the entire time. You can decide to stay for 1 hour, an hour and a half, based on how the person responds to the environment. And social interaction is very helpful, and desirable for anyone who is receiving care, to the extent that the caregiver or the care partner is able to facilitate that. If they're working with somebody who may be coming in your home, ensuring that the staff is trained to work with that particular person, providing walks and physical activity. There are a lot of chair exercises on YouTube. You can, the evenings and the days here are getting warmer now, so you can go out for short walks. And then light therapy and sleep intervention. So that is being exposed to light when you wake up in the morning, so that your body knows that it's day. Because one of the things we see a lot with people living with cognitive impairment and dementia, once more, is that their circadian rhythm. So this 24-hour rhythm that we have, where we're awake during the day and asleep at nights, tend to be misaligned. So, a person living with cognitive impairment and dementia might sleep during the day and want to be awake at night. So light therapy, when they're awake in the day, kind of helps once more to the extent that is feasible and possible, to entrain the body back to a 24-hour rhythm. So light therapy, when they wake up, would say to the brain, I'm awake, this is day. And as the day progresses, kind of decreasing and declining decreasing the exposure to light. And then sleep intervention. So, not having a television in bed, reducing the amount of naps you take or the person takes during the day. And if they do have to take naps, to limit those to before 3 p.m. And, short naps. So they're not taking a 2 or 3 hour nap during the day and calling that a nap. That's like sleep. So very short naps if they're having naps. And ensuring that the bedroom says, when you get into the bedroom, it's time to go to bed and to sleep. Does anybody have any questions or comments so far? All right. Okay. So as you are taking care of someone, you might develop what we call compassion fatigue. And that is a stress response that involves the physical, emotional, and spiritual weariness or exhaustion that results from prolonged exposure to difficult situations. And, caregiving is challenging and hard a lot of times. And while it is rewarding, it does require quite a bit from the person providing care. Um, because sometimes it can reduce your ability to nurture, care for, empathize with the person who is experiencing the illness. So people who are at risk might be professions which have prolonged exposure to other people's trauma. So nurses, other healthcare providers, and persons who are employed, who are working extra shifts or taking days off or neglecting their own self-care. And then family caregivers who, whether they're taking care of a person living with dementia, somebody with chronic illness, a young person who has a chronic illness, that exposure continually to this difficult situation might lead to that. Um, and some of the symptoms you might see might be exhaustion, disrupted sleep, anxiety, headaches, irritability, numbness, feeling a decreased sense of purpose, emotional disconnection, or difficulties with personal relationships. And it's not anything that you need to feel guilty about or anything like that. It's just that sometimes when you've been exposed to something for so long, it could also be the body's the body trying to protect itself, to say to the person, maybe you need to rest, maybe you need to take some time off, some respite, to kind of re-engage and get back who you are. And it's also the body's way of, technically protecting itself, right? So you're becoming numb, maybe, to be able to do the job that you're doing, but you're unable to kind of empathize once more with the person who maybe going through, or you're providing care for. So what can you do? Oh, is to take care of yourself emotionally. We're all very familiar with, you have to put your oxygen mask on first in order to put it on somebody else. So emotional self-care. And the first thing is identifying and becoming aware of your emotions and feelings. So whenever something is happening, being aware that, okay, I'm not feeling, there is a situation here that's bringing on me not feeling really good. And then, identifying the feelings or sensations that you're having. Where are you feeling it? In your body, in your throat, in your stomach? What thoughts are you having that's indicating what you might be feeling? Are you then saying to yourself, no, I'm not feeling like this isn't really happening, this isn't what I'm going through? And are you having any judgments based on the thoughts and the feelings that you have? And are you having any urges to suppress or move away from those feelings? And ask yourself why you're having them. The next thing is the ability to stay with and accept the feelings in order to process them. Um, so tolerating difficult emotional states can be difficult, but feeling what you're feeling will not kill you. Acknowledging what it is that you're experiencing would then allow you to move forward. So whenever you're experiencing a difficult emotional state, practice slow breathing, and we say counting to 4 as you breathe in, then counting to 5 as you breathe out. So that kind of helps you stay present within that moment, but not necessarily, you won't have to respond necessarily to whatever it is that is going on. And as that is happening, asking yourself, is this tolerable? Why do you think it's not tolerable? If you think it's not tolerable, and if you're feeling the feeling, do you think something bad is going to happen if you allow yourself to feel whatever you're feeling? And are you having any physiological sensation as you're feeling it? So how can you tolerate it? To breathe, relax, stay still, to manage it. And then the third stage is to process in order to act on the emotion appropriately. So this stage is basically about understanding why you're having the feeling so that you can move on to the next stage. And asking yourself questions once more. And only you're the only one who can answer these questions. Are there any needs that you have that are unmet? So do I feel misunderstood, unheard, disrespected? Do you have boundaries, and do you feel that somebody has violated this boundary? Is there a value that you have that has been compromised? Is this emotional distress as a result of a thinking that may not be aligned with what your beliefs are? Is it triggering for you? And is it a buildup from different events? So it might not be this one event that just happened. It could be that multiple things has happened that had built up over time. And then finally, addressing the emotion. So it's not easy to know how to deal with an emotion or a feeling, but it's very helpful to talk with someone whose judgment we trust to get a balanced perspective on what might be happening. So it might be someone, in your group, your friend group. It might be someone, it might be a professional. So I know at at Emory they do offer the employee health services where there is support there, and they can they can refer you out if need be. Is it a church friend? Is it a pastor? Somebody that you can kind of speak to and process what it is that you're feeling and thinking, and then work on reframing it into more helpful ways so that you can release it. So I always say it's okay to feel what it is that you're feeling, and then you can accept it, process it, and then move on. But what another thing that means is that when you're feeling it, you may not necessarily have to respond in the moment, but as the feelings and the processing happens, then you can come back. And after you've accepted the moment, the emotion and processed it, then deal with kind of what the trigger were or what led to that. And if a person was it, then you can talk to them. If it's a person who is living with cognitive impairment, perhaps they may not understand what it is that you're trying to communicate, or even in the moment, if they understand, later on they might forget and the situation may happen again, but then at least you would have identified and processed it previously, so you would know kind of how to reframe it if it happens, or when it happens again, if it's a person who's living with dementia, because there's a possibility that if you're living with someone who's living with cognitive impairment and dementia, that many times situations might happen multiple times. Um, Yes. So what can you do? If it was a need that wasn't met, you can get a need met, or you can assert yourself, reestablish a boundary, let the feelings pass, express your thoughts and feelings to someone or through journaling, and realign yourself with your values and take corrective action. Do the opposite of what your urge is. So if your urge is to isolate and to sleep, go and take a walk or talk to someone. And then if you know it was something that you felt like you did, apologize or make amends. Another one is mindfulness-based cognitive therapy. And this is a 3-minute breathing structure for noting, grounding, and allowing during challenging situations whenever automatic pilot thinking takes over, like during a shift or for simply starting or ending the day. And you can also do this with your loved ones. So you can both do a 3-minute breathing technique, and you can do it together. Psychic numbing is your ability to just dial down your empathetic instincts while you're on the job or while you're providing care, so that you can free up cognitive resources to find solutions to the problems in front of you instead of becoming paralyzed by the scope of need that you see. So sometimes with caregivers, you may to an extent need to do some psychic numbing. So you just remove yourself from all this empathy that is there for the person to say, okay, I see my loved one in front of me, or I see the person who I'm taking care of in front of me, but I can't get caught up in feeling empathy at this moment when something is happening. But then how can I identify what the situation is and find a solution to the situation? And then therapy, professional resources that can help you to change behavior, overcome problems, help with coping, identify and support you as you move through the process, and finding ways to cope with the situation that is that you're experiencing, and physical activity that's always helpful to release endorphins. Um, and then boundary setting. So personal boundaries are the limits you decide to work on for you, on how people can treat you and how they can behave around you and what they can expect from you. And it's often shaped by our heritage, our culture, where we come from, where we live. And with personal boundaries, it kind of allows us to conserve our emotional energy. And they are drawn from what our beliefs is, what our perspectives and opinions are, and they are created from our life experiences and social environments. So are we introverted, extroverted, or in between? What are our family dynamics? And I think a lot of times, um, our boundaries kind of would help us to identify, okay, if we're taking care of somebody living with dementia, and we know that the illness is going to progress, then are we going to say we're going to keep them at home with us all the time? Or do we say, okay, this is the limit, that like if this starts happening, then I would have to seek assistance for somebody to come into my home to help me take care of this person. Or if I'm no longer able to do that, while it might be really hard for me to consider thinking about the need that I have to replace this person in a long-term care community, a residential community, a nursing home, one of those places. And it's important to start maybe establishing those boundaries early on, so that, if it does happen, then you would know that, okay, maybe I'm not able to maybe manage this independently or by myself anymore. Or if this starts happening, then maybe I might have to bring in additional family support to help me to be a caregiver, and take care of my loved one. So another way for us to take care of ourselves is to preserve our brain health. If our brains aren't working, then our bodies aren't working. So the first one would be well, it depends. In the 6 pillars of brain health, be social. We work a lot, and then many times, even if we work a lot, we might then have to go home to our responsibilities. So as a result, we may not have that much time left to be social. But it doesn't mean that we don't have to be social, or go out every day, but find time to keep in touch with friends and families. Don't let yourself get isolated. Socialization actually is it helps with really protecting the brain, because you're having conversation and engaging with people around you, by being social, and that helps with ensuring that the connections within your brain remain and are maintained. The next one is to engage your brain. So find ways to stimulate your thinking, explore new interests and hobbies. And if you're at Emory, whether in healthcare or in the university, they do support, whether it's taking courses or extracurricular activities, but find ways to learn something new. I always see these, what am I thinking? So they have many emails that come out about many things that the HR might have, or employee health, or activities that employees can always participate in. There are many groups and activities at work that you can choose to participate in. And if you don't want to do it at work, then you can do it with your friend group. You can do it with church, where you can say, okay, maybe we can start organizing to learn something new over the next month or the next 6 weeks. We can organize a course. So we are being social, and then we're also engaging our brain. Manage stress. So find a way to do that, whether it's relaxation, a daily schedule, exercise, anything that you need to do to manage your stress. Saying no. I know that sometimes it might be hard to say no to your employer, or to say no to your friends, or to say no to your pastor, or to say no to your spouse. But sometimes saying no is an important part of managing stress, because if you have 10 things that you're doing already and you add an 11th, that might just introduce additional stress that it might have been easier for you to say no and suggest somebody else to do that. Ongoing exercise, so moving throughout the day. Target 2.5 hours a week of moderate physical activity. And we have to definitely be intentional about that once more, because there's always so many things that we have to do and we're expected to do and we are doing. So we have to be intentional about finding time for these things throughout the day and week. Getting restorative sleep, the recommended is between 7 to 9 hours of restful sleep every day. And by restful sleep, we don't mean that you go to bed and then you sleep, you have consolidated sleep all the way through the night for 7 to 8 hours, but it means that you're falling asleep pretty quickly when you get into bed. And even if you get up 2 to 3 times to go and use the restroom, or even when you're turning over and changing position, that you wake up, that you're able to fall back asleep when you get to bed. So if you're going to bed, maybe you fall asleep and 3 hours later you're up and you're up for 2 hours. That's not necessarily restful sleep, and maybe something you need to speak to your healthcare provider about, that maybe they can help you to identify what it is that's keeping you up and keeping you awake, and identifying whether or not there is a sleep disorder that may be on board that you may not be aware of. And then eating right. So choosing a nutritious, hot, healthy diet. And to protect your brain, we talk about the MIND or the DASH or the Mediterranean diet. So the MIND diet is an integration of the Mediterranean and the DASH diet for neurodegenerative delay. And the DASH diet is dietary approaches to stop hypertension. So that's a low sodium diet. So it doesn't necessarily mean it's not no sodium, but it's lower sodium. And I um I know that we probably none of us have a problem with getting sodium in our diet. So it's just lowering the amount that we are exposed to. And then the Mediterranean diet, which is a focus on that, eating fruits, vegetables, and healthy oils, and the healthy fish, reducing, the red meat. And so those were the things that I had to talk to you about today. I tried to make it broad. So it wasn't only about caregiving for somebody living with dementia. There are many programs that are available if you're a caregiver in general. So, you can look for support groups that you can actually attend for. If it's a dementia, it might be an Alzheimer's Association support group, or if it's for maybe a younger person, then they have support group for if you're a caregiver for a younger person with a chronic illness. So there, look in the area where the person of the chronic disorder that the person may have, and there should be support groups for you within that area. Those have been shown to be very helpful also. So thank you very much for having me, and I will entertain questions.
Thank you so much, Dr. Brewster. That was really helpful, really informative. So for everyone in attendance today, feel free to use the question and answer function, the chat function. I've also given everyone the ability to mute and unmute themselves if they want to ask a question that way. I know we did have one kind of question come in the chat during your presentation from Andrea from the school district, who just asked, are you able to touch on how to deal with feelings of guilt if an individual has to move their loved one into a facility?
So we know that it's complex. I think one of the main things that bring about guilt is our expectation that we are supposed to take care of our loved ones with us to the day they die, to death. And whenever we are, we have to ask ourselves if we're able to do this. And when we get to the point where it may be that they're safer, it may be that, they have multiple things that they have to that you have to manage for them. So maybe they have hypertension, diabetes, and if they have cognitive impairment or dementia, and you have to manage everything that goes with that. So you have to take them to their primary care providers, you have to manage their medications, you have to find their meals, you have to ensure that they're safe. If they wake up at night, and that may be interfering with your and their sleep. So when you look at the things that may ensure that they're safe and they're taken care of in an environment where somebody's with them 24/7. I think it's about reframing what the situation is. So when you're reframing it to, I really wanted my loved one to be with me here, but I couldn't be with them 24/7 because I had to work. I wasn't at the point where I could retire and stay home with them, and as a result, it would be safer and better for them to be in a a resident. I have chosen a residential community. I'm not a fan of institutionalization and facility. So I tend to say residential community where somebody can be there who will be taking care of them 24/7, to the extent that is possible, most of the times, making sure that they're safe and giving them their medications the way that they should. We know that nobody ever can take care of a loved one the way that we can, I think as well as we can. But given our limitations, I think it's important to recognize that when I'm working within my limitations, maybe this is the best place for them, for me to do for them and for myself too, for my health, for my wellness. And it doesn't mean that because they're in a residential community that I don't get to see them. Many times you can go and visit them every day. I had a friend of mine, well, I have a friend, her grandmother was placed in a residential community, but every day her mom went, or they went and visited her. They went and had meals with her. They went and, sometimes would give them their evening bath. So it facilitated, I think, better health outcomes for everyone involved, because you can still go and visit them, but you're not necessarily responsible for them 24/7. So I think that's one of the way to deal with the feelings, is to kind of reframe the way that you think about it.
So we have another question that came in that said, could you recommend any, I'm going to call it, you said
Residential
communities,
communities.
for dementia patients? And, maybe if you have specific places in mind, but even if not specific places necessarily, maybe what are some key factors to look into when considering how to, find that community for a loved one?
Yes. So I don't have any specific places, but what I would say is, before you make a decision about where you're going to place the person, it would be to make sure that you visit multiple ones. So you have choices before that, knowing what exactly it is that you're looking for. So are you looking for a place that is, because sometimes with people living with dementia, they have a specific memory care unit that they'll be in. So you're going to ask, like, can I come visit them whenever I am able to, whenever I want to, or are there specific visiting hours? What is your policy when it comes to people who might be wandering or who might not want to take their medications? Or what are your policy when it comes to hands-on care for the person who's living with dementia? What activities do you provide for them during the day? In addition to that, what are the costs associated with it? And because I think some may accept insurance or some don't. So finding out about the cost associated with that, and how that payment structure is. And there are also agencies that you can work with that would help you in finding the right place to place your the person who's living with dementia. So you can also look for agencies that may be there that would find you and help you and support you as you go through making a decision about where you want to your loved one to live for the next few years. And it's not forever, right? You can always tell them that you don't want to do this anymore if your situation changes, and bring them back home with you. It'd be like, well, maybe I retired now and I could have them back with me, or something like that. So find out once. I think you have to sign contracts, making sure that you understand what is in the contract and stuff like that.
I know we also,
Thank you.
during the presentation, that Andrea put some info in the chat for everyone in terms of some resources that you all have as employees of DeKalb County School District, some of your kind of employee support services that you all have. So
Oh,
that
yes.
information is
So
there.
maybe, yeah, I think I said Emory.
I was going to say, I
with
know
free
they have a very
resources, right?
similar program. Yeah, yeah.
But also, I think, maybe I'm sure within DeKalb County, there are courses that they offer that you can take and stuff like that to help with brain activities and learning and doing new things. So, yeah.
Yeah, my mind always went to too. I know there's a lot of for folks who have LinkedIn accounts out there.
Right.
Which if you don't have one there, you can make a free one. There's lots of really great, they call them LinkedIn
LinkedIn
Learning.
learning.
A new
Yeah.
fun and easy way to learn something new.
Yeah, and then there are a few online sites too where you can learn, you can take courses and things like that, so you can keep learning and doing new things.
Anyone else? I know we still have a few minutes left. Any other questions, comments?
I would also
I have a
say,
quick question if I could ask.
sure,
Oh, yeah,
go ahead.
sure.
I'm currently a caregiver in my home for a person that has early onset,
Hmm.
and I'm wondering if there is certain language I should be using or avoiding by chance. I know I've done a little bit of research and talked with a couple of medical providers. I'm just trying to find out ways in which I can make it, you know, a better experience for us
Hmm.
both.
Okay.
Also, when in moments of hallucination, should I not be disagreeing or agreeing with the behavior that is occurring?
So I don't know if you, so Emory has a program called the Cognitive Empowerment Program, and that's actually a program for persons living with cognitive impairment and their care partners. So it's through the Gwyzetta Alzheimer's Disease Research Center. So I would Google that and see whether or not you may be eligible, because that may be something that may be helpful for both of you. Another thing might be, I don't know who the person is. So there's sometimes where there's some people who know that they have cognitive impairment and they're aware and they're okay with saying they have cognitive impairment. And then there are other times where the person doesn't necessarily have insight or they're in denial, so they don't want to hear that they have cognitive impairment. So it depends on that. If the person is having like hallucinations or delusions or anything like that, one of the things I would say is to speak to the healthcare provider about it, so because it's possible that there might be, potential medications they can take for that, or if they are so if you have a someone who may be saying that I want to go back to home, I want to go home, and you're in a new home, but their home was probably one that you lived in previously, it might be saying, okay, well, come on, let's go for a drive. And then by the time you've gone for a drive and you've returned back, they would have forgotten that they wanted to go home. So distraction a lot of times helps with or redirection. So redirecting to something else or something different to do helps with getting them out of being, as it were, stuck in that space of this is what I want to do at this particular period in time. So redirection helps a lot. Correcting the person is not going to help because they're not really, they're sure what it is that they're seeing that is happening is actually happening. So correcting them isn't going to help, but redirection tends to help a lot. The Alzheimer's Association, somebody mentioned, has a lot of good resources. So they have support groups. They have an 24/7 hour number that you can actually call if something is going on, and actually social workers would answer that number if something is going on and you want to describe the behavior to them. Many times they're able to provide you with suggestion in that moment about what it is that they need to do. And another thing might be ensuring, like if they're still driving or if they get violent, and maybe you might need to call someone to ensure that maybe the area that you live in, the police or whomever is aware of the diagnosis, so whenever they if they ever have to respond, they'll be aware, so they're not coming guns blazing, but they're coming with the knowledge that this person that I'm interacting with has cognitive impairment and dementia. So maybe they might be more aware of what's happening and what's going on. So those might be some proactive things to do. But I would say definitely setting yourself up and getting into like a support group. And then we have, like, if you want to email me after, we have research studies that is happening within the School of Nursing and within the Gwyzetta ADRC for persons living with cognitive impairment and their care partners that you may be eligible to participate in. So I can always send some of those studies, but if you're also interested, my email address is here. You can email me and I'll share those with you.
Thank you.
You're welcome.
I've seen we've had, again, some other folks just putting some great information on resources in the chat. Dr.
So the
Brewster,
Guayzeta Alzheimer's Disease Research Center.
I'll also put your email address
Yeah.
in the chat as we speak as well for everyone.
The Cognitive Empowerment Program is the one at Emory. Oh yeah, Lindsay put it there. Yeah.
All right. Any other questions, comments? I know one kind of quick question I had, that I've heard this term a lot, but could you just quickly describe what exactly the term, what is it, sundowning, I want to say, means?
Sure. So I thought you were going to ask me, because a lot of people often ask to the difference between dementia and Alzheimer's disease. And so dementia is the overall term. We think about it like the umbrella, and then the spokes are the different types. So we have Alzheimer's disease, vascular dementia, frontotemporal, all the different types. So Alzheimer's disease is a type of dementia. But many times, sundowning is a group of symptoms that we might see. So it might be outburst, change in behaviors that we see as the afternoon progresses. So as it gets to, as the sun is going down, then there might be behavioral changes that you see in a person who's living with dementia. So that's what we call sundowning syndrome. So as the sun is going down, the changes in behaviors that we might see. So the person might become a little bit more anxious. They might become a little bit more irritable. They might start having, outbursts, getting loud, getting angry. And it's not something necessarily sometimes that they can manage or control. But, when you see that happening, or when you say, okay, maybe it's 3 o'clock now, and around 4 o'clock I'm going to start having those seeing that behavior starting to happen. Can I do something then? Can I maybe take them outside so that they can get exposure to some sunlight? Can I do some activities with them that is going to cause this time to go by? Because it's uncomfortable for the person too. It's not only about you, and seeing this behavior, but the person doesn't necessarily want to have the behavior. But sometimes, when your brain you can't manage certain things that's happening in your brain, then this behavior comes out. So what are some of the things, and it's trial and error, that you can do that may reduce those symptoms? Grants that can support care. I would say there's the Empower line in Georgia that you can call. Empower line, you can Google that. I don't, but there's a number that the Empower line that you can call and ask based on. I'm sure there are some CCSP, I think also, but a lot of those you qualify based on if you're making a certain amount or if you're not. So you have to kind of fill out the documents and figure out whether or not you qualify. But I think the Empower line might be able to give you some guidance and direction about that. And even the local area agency on aging may be able to give you some directions about it. And if you have a social worker, they oftentimes are able to have some resources that they can suggest.
Awesome. Well, thank you so much, everyone, for joining today and for all of your great questions, comments, feedback. Again, we will be sharing the recording as well as the presentation afterwards. I am going to quickly share my screen to show you all what our next upcoming presentations that we have. So for March, which is already right around the corner, starting next week, next Wednesday, we have a presentation on tips for a healthy heart, which is going to focus a lot on some overall health and wellness information as well. In April, we have a presentation on medication management and substance use disorder and addiction. And then lastly, in May, to finish out the school year, we have a stroke education and prevention presentation for you all from some of our stroke coordinators that we have on team here. So again, Dr. Brewster, thank you so much. We really appreciate your time and your really helpful insight and information. I know I personally learned a lot today, so I hope everyone else was able to take something from this. And with that, we'll say our final thank you. Thanks for everyone for attending, and we look forward to seeing you all at the next presentation.
Thank you so much for having me.
Thank you. Have a good day.
You too.